The Ebonyi State government is committed to speedy completion of the College of Medicine. This is part of the state governor's agenda of aggressive infrastructure development. When completed, the College of Medicine will be the biggest of such institution on the continent and will cut down the rate of medical tourism abroad. Governor Umahi has promised that the facility will be equipped with the best equipment for the treatment of liver problem, cancer, heart diseases, heart and kidney transplant. And joining me on the news to discuss more on the development in Ebonyi State is the Commissioner for Information, Uchenna Orji. Good to have you join us.
Thank you very much.
Let's look at this feat really being commendable. One must say that to have a facility like this that will help Nigeria curb medical tourism is commendable. But there is also the worry as to when this will be completed and if we have the required manpower to man all of these facilities. We're looking at several equipments here.
As a matter of fact, you have mentioned it, or that the governor actually decided to embark on this aggressive infrastructure development in order to solve the problem of medical tourism. But beyond that, the governor is thinking about raising the economy of the state through a creation of jobs and engagement of the medical officials. And I can tell you that what the governor is thinking about is to have expatriates in the first instance to drive the management of this facility. It's going to be the biggest facility or medical college in all of Africa. And it's going to have a dialysis center only in Africa. Of course, like you did say, this is a center of excellence for the cure or treatment of liver problems, heart diseases, even heart transplant, and even liver and lung problems. And I want to say that the way the governor is pursuing it, you would imagine that this started a couple of years ago, and it's pretty short to complete this before he winds up or bows out in 2023. And I want to say that his idea is to engage and to fully equip the entire system such that every part of the country or even the continent, you can move to Ebonyi State. It will be a medical tourism for the people of the continent. And what it means is that the era of traveling abroad, capital flight, and all of these issues will no longer be something that will be tenable. Now, how can this succeed? The governor is actually very systematic. Before he goes into any vision, he must have planned on how to really source funds. I'm telling you that he's liaising with necessary donor agencies, development partners, not only in the area of sourcing of funds, including federal government, but also in the area of ensuring the management of this wonderful edifice, this facility. And when that happens...
Sorry, if I may just comment, when you say donor agencies, we understand that these are grants that might not be repayable. But how sustainable is that in terms of funding? Is the governor also looking to take loans, looking at the fact that when you compare the IGRO of Ebonyi State with states like Lagos and Port Harcourt, River State rather, it is nothing compared to the IGRO generated by these states?
Yeah, you need to see the level of work done. I may not tell you the various sources of funds through which this level of completion has been attained. But I want to tell you that the governor actually did capture and factor the whole of this process in the budget. So it's not going to be an issue. But intensively is working with federal government, donor agencies to ensure that this very dream is actualized. And as I speak with you, we are nearing about 70% completion. The equipments are on ground. He has also discussed with necessary management, officials out of this country to see how they can come and fix their place at least, going forward for a period of time. And the idea is that there will be a succession plan in the management such that by the time the expatriates are through, by the time they are pulling out, would have had enough fund. What did he do further? He now had to build further medical institutions. We have the College of Nursing and Midwifery. We are the capital of the nurses, the capital of the doctor, the medical doctors is raised to really ensure that we have no issue about personnel. And it is going to be structured in such a way, a manner that is going to be self-sustaining. There will be no government interference in the whole of the process. But you need to see this wonderful edifice, really heaven on earth.
Like I said, this is commendable, but the fact that the governor has to bring in expatriates already shows that there is some level of deficit in terms of human capacity development. And not just, this is one aspect. You've talked about the succession plan, but this is just one aspect. And I want to bring to your attention a report, which we cannot verify, but I want to bring to your attention, which says that a good percentage of hawkers in Lagos who are from the southeast are from Ebonyi State. Are you aware of this report? And if you are, what is the governor doing to ensure that this situation is not the norm?
I concede to you that before he came on board, we had this issue of Ebonyans hawking in major cities of the country. He didn't waste time in taking the bull by the horn. The first port of call was to come to Lagos. And he had to engage or discuss with these youths and women, and now had to introduce what is called Street to Skill Empowerment Program, whereby a total of 520 number youths and women hawking in the streets of Lagos were really, shortlisted, trained in entrepreneurship and vocational programs, and they were empowered, each with 250,000 naira grant. That has taken away 520 number youths and women out of the street with their families. So that has really made an impact. So the governor is doing a lot. We have a lot of programs in empowerment. We have the NSAS empowerment that he just introduced a couple of weeks ago, which 3 billion naira has been set aside for the empowerment of youth, especially as a result of these NSAS agitations. So every youth, every woman, every even civil servant, businessman is entitled to access this facility, provided always that you have the requisite qualification, especially business plan. Now, again, we have had a lot of empowerment programs. Tricycle empowerment program is for the parents of the poor youth and women, both within the shores and outside the shores of Ebonyi State. He had to procure 400 number tricycle from Lagos at the cost of 650,000, 260 million naira for 400 number people, and gave free of charge, including those hawkers in Onitsha and Anambra State. So this program or empowerment program is a continuous process. But beside that, he had to introduce what is called out-of-school program, for out-of-school people, aimed at harvesting those out-of-school or dropouts and bringing them on board through free and compulsory education, which is made compulsory for every of the persons found. These are some of the measures that he has really adopted to ensure that we get down the issue of hawking among the people of Ebonyi State.
Well, it's one thing to have policy implementation, is another thing to see results. We'll see how all of this play out in the coming years of the governor's tenure. Ebonyi State Commissioner for Information, Uchenna Orji, thanks for talking to us.
Thank you very much.